Good day, dear viewers, and welcome to our series Visit Tonight. I am pleased that you are taking the time, and perhaps I take this time to thank you again very much that this show live with so many valuable and interesting emails from your side. And I would like to lead straight to Sabine. Sabine is from Austria and she writes me the following email. Dear Dr. Wiechel, thank you very much for the interesting and informative Visit broadcasts, which have opened up things in everyday life that we have only perceived in such a limited way from our perspective. Thank you for that compliment, Sabine. And today we turn to you with the following question. My husband is faced with a tumor diagnosis. We want you to let us know how your recommendation is in terms of a vitamin C high-dose treatment. And I want to dedicate this show to this problem because I observe in everyday life that we do not do these things in any way, even in an oncological cancer therapy, and don't appreciate at all what it means. About 3 years ago I happened to see a report on German television very late in the evening. And there, the topic of vitamin C infusions was shown in a way that naturopaths were shown, and also the value of these infusions or any support for flu infections or in tumor therapy were described as a very expensive treatment but without medical value. And I am pleased with this presentation today that you ask me this question, because the human organism is not able to form vitamin C itself, to synthesize it. This is reserved for animals. Through this so-called gelatin, we actually lost our opportunity to synthesize vitamin C. That is, if we don't make up for it in everyday life, and we don't need much, but if we don't have it anymore, then you all know this illness of seafarers back then, that they would get sick from scurvy. But what is scurvy? What is a vitamin C deficiency? This means that vitamin C has a multi-causal influence in all our metabolic processes and above all as part of our regeneration services. Because if we know that vitamin C is responsible for a good, powerful structure of our connective tissue, our bones, our cartilage, then, as a highly civilized society today, we just assume that people take in enough of it. But that's not always the case. Because vitamin C comes into contact with many other things, and vitamin C can also be essentially blocked in our metabolic processes by our modern life. And humans don't have that much intake and not so much vitamin C content in the fruits, in the vegetables. This means that vitamin C is involved in the formation of very valuable collagen fibers. Collagen is the structure of connective tissue. Who today thinks in terms of diseases of our joints of vitamin C? That is no longer noticed. Vitamin C is also responsible for the conversion of dopamine to norepinephrine in the context of neurosynthesis and in the formation of carnitine. Carnitine is also very responsible in the context of our cell energy metabolism. We may sometimes observe when we have bleeding gums or when we notice bad wound healing, that it lasts longer when we feel joint inflammation. But also tiredness and exhaustion are signs of a vitamin C deficiency. It is one of the highest antioxidants and it is a cofactor for quite a lot of biochemical processes that we need, because of the formation of free radicals in the metabolism of oxygen. Vitamin C binds these free radicals and has an important key position today, by naturally influencing such enzymatic functions. Maybe a few more words about vitamin C. But the superiority in tumor diseases is completely underestimated, and that is something where I say I also have to take vitamin C infusions, and that involves completely different dosages than we take in oral therapy. I must be experienced to work with it. Already Lewis Pauling, as the father of orthomolecular medicine, observed for a long time that 10 grams alone, so 1,000 milligrams, have a significant effect on even advanced tumor processes. This means that vitamin C can, of course, now, when it is infused, switch off the so-called transport blocker that we have in our intestines by directly admitting it moderately intravenously. Vitamin C is metabolized quite quickly, and it makes no sense taking a dosage of over 2,000 milligrams a day, by no means once, if then in really many small doses, because only little is absorbed and this is regulated by the body itself. What is in excess is simply excreted through the kidneys. That is why there are such preparations that have a depot effect, that is, if 500 milligrams are given as a depot, they are only released in the organism over a certain period in order to be absorbed in spurts through the intestines. Therefore, small doses, 200 milligrams spread over 5 times, for example, or, as I said, depot preparations, where you might be very happy to take 3 times 500. But make sure, a higher, better absorption is of course liposomal, the encapsulated vitamin C, and that has an exclusively higher absorption capacity than any other. But we're talking here about the high dose. And when we talk about the high dose, we're not just talking about 10 grams, we are talking about well over 30 to 100 milligrams of vitamin C. And of course that belongs in the hands of a doctor, because at that moment it is given intravenously. Why? Vitamin C in this dosage is no longer an antioxidant in the sense of an anti-free radical, buffering, relieving antioxidant, but now it's a pro-oxidant, and oxidants have a sharp effect. These are big, big guns. At that moment it comes intracellularly or also extra, so outside the cell, to a so-called induced reduction of metal ions and cations, and above all of iron and copper. This in turn activates an enzyme and leads to the production of hydrogen peroxide. You all know hydrogen peroxide 3%. The body is also capable of a certain proportion to form hydrogen peroxide again and again. Of course, it has a very high antibacterial, antiviral and antiparasitic opportunity to face everything that weighs on it. But the ultimate key now is the formation of hydrogen peroxide, then the penetration into the cell, and of course essentially the self-shot against the tumor cell. At that moment, vitamin C naturally has a highly anti-tumor effect. We call this as medical professionals, it has a very high cytotoxic effect. And interestingly, it has no side effect. So what do I want to achieve with an anti-tumor effect? It will always be much more effective if I keep the side effects small, because every normal chemotherapy can never have a selective effect, but always has a direct influence on particularly fast-growing and also healthy cells. And that's important now because, of course, vitamin C has a cytotoxic effect, on the one hand extracellularly, and thus affects the cellular energy metabolism. The cell continues to fall into an energy starvation, and on the other hand it affects the DNA and also glucose metabolism. And that's interesting to know. And now you might need to be patient with me again to bring a problem to your attention, which is also very important in the context of a tumor disease. Professor Greg Semenza received the 2019 Nobel Prize because he researched HF-alpha. And HF-alpha, as a so-called HIF, is called hypoxia induction factor, and also explained in a significantly scientific way what influence this factor has on the cellular energy metabolism. My first encounter with HF-alpha was back in 2009 when I met Dr. Coy. Years earlier at the Cancer Research Institute in Heidelberg, he brought the realization of HF-alpha and the great works by Professor Warburg in the 1930s to a new level of knowledge. And you knew that when a cell goes into hypoxia, not eating for days, weeks, no problem. Not drinking for 3-4 days, not very valuable, but you will not die. The real problem starts from then on. But if you stop breathing for 3 minutes, irreversible damage occurs intracellularly, the brain switches off, which means that our body actually has incredible mechanisms for the lack of oxygen, which it turns on immediately to overcome this hypoxia, so to compensate for the insufficient supply of the cell immediately. These are emergency measures. 100,000 bells ring in the organism, and via this HF-alpha, via this hypoxia-induced factor, which is represented on all so-called endothelial cells in the vessel walls, which is represented intracellularly, it can boost a reaction immediately. That means it is a signal that the body perceives, puts all other signals aside, and now via a hormone, that is erythropoietin, it primarily produces enough red blood cells via the liver and kidneys. Of course, these red blood cells are the ones that transport oxygen. And if there is little there now, but enough capacity to transport it, that is a compensation. Of course there is a jostling in the vessels, because the other effect is that now nitric oxide is produced. And nitric oxide, which every cell produces, naturally also has the effect of having a regulatory effect. Here brings the vessels into a great relaxation. At the moment when the relaxation is there is of course also the possibility of transporting these red blood cells well. The clumping of the red blood cells also is prevented, and on the other hand also it prevents them from sticking. That is, If HF-alpha is responsible for that this cell now is much better supplied, then HF-alpha also ensures that angiogenesis takes place. And angiogenesis is a very, very interesting aspect, because this allows a tumor cell to dock onto new capillaries, onto new vessels, which the body stimulates via this signal. That means, this is a self-regulatory process that is also present in the metabolism of a tumor cell and has an essential aspect, because the system re-establishes itself in a large autonomy in its metabolic process and thus also brings this metabolic process forward. It is known today, and has been known since the 1930s, that a tumor cell can of course be damaged by destroying or switching off its power plants is set up for such a hypoxemic state. Each tumor cell uses 18 times more sugar and does not need the oxygen. And I'm coming back now as I don't want to complicate it too much, but this HF-alpha will be switched off in its activity by high doses of vitamin C. And that is of course a very interesting aspect, to understand that high-dose therapy can essentially influence these intracellular tumor events. By the way, if you, for example, do induced hypoxic interval training power, IHHT, we already have broadcasts as well here on QS24 TV about this. That's something I do naturally in my normal healthy state and can train that this better capillary supply in a healthy cell gets a high stimulus again and again, to positively support the body in all its cell and energy metabolism. And with that alone Pauling saw, and later also, many scientific studies up to and including today are available, that the high-dose therapy forces tumors to a remission as well as to a real stop, or can also block the development of further metastasis. These are really things. I don't know more about you than that I only had the task today to say, how do I think about vitamin C? It's been a big, fixed part for me for 30 years in anti-tumor therapy because the understanding of the causes of a tumor occurrence must be important. Nature makes no mistakes. A tumor is not fate. A tumor is an act of desperation of a cellular metabolism, which had to develop a switching phenomenon in order for the cell to survive. And now we know so much about it that I can't understand why we can't use these things in the framework of a tumor event. High-dose therapy for me, 0.5, for example, 5.3 milligrams per kilogram, and you can calculate with that. Don't just do it, because of course these things can also go wrong with renal insufficiency, because then severe kidney stones develop, because of course it has to be excreted and this leads to crystallization. It is very important to measure glucose 6-phosphate dehydrogenase beforehand, whether this enzyme activity to break it down again is present. High doses of vitamin C, of course, not only for tumor diseases. There are a number of diseases such as susceptibility to infections when you are tired, when you are under stress, which is often also due to this oxidative stress. Adjunctive therapy, of course, with chemotherapy and radiation therapy in cancer aftercare, wound healing disorders, Many processes in the healing process after operations, accidents, rheumatism, asthma, bronchial allergies, angina pectoris, circulatory disorders. Circulatory disorders in combination perhaps with an IHHT, interval training, hypoxia to create new collaterals. Don't forget, life is always pushing. I want to create balance myself, help me in this process, thrombosis, risk of embolism and so on. So this time is not enough at all to deal with such a wonderful big topic, and yet I believe that maybe I was able to help you to be a lot braver and just to discuss these things with someone who can accompany you well, whatever the therapy will look like now. But my experience in these 30 years is more than positive, and I can now tell you at this point, I wish you all the best for your husband. And to all of you, dear viewers, I thank you very much for your attention today, and, above all, whenever you have questions or need my medical advice from a holistic point of view, then with pleasure, I accept all these things at Visite at QS24.TV and find them very interesting to build a nice next show out of. Thank you very much and have a very nice week.